Welcome to This Week in Health IT News, where we look at as many stories as we can in 20 minutes or less that will impact health IT. It's Tuesday Newsday, and here's what we have on tap. Providence St. Joseph Health acquires Epic consulting firm Bluetree. Philadelphia's Hahnemann University Hospital files for bankruptcy, and why no single health incentive works. New England Journal of Medicine Catalyst. Look forward to covering that. My name is Bill Russell, recovering healthcare CIO and creator of This Week in Health IT, a set of podcasts and videos dedicated to developing the next generation of health IT leaders. This podcast is brought to you by Health Lyrics, technology coach for health executives. Let's talk. Visit healthlyrics.com to schedule your free consultation. Want to support the fastest growing podcast in the health IT space? Here are 5 easy ways you can do that. 1, share it with a peer. Number 2, follow our social accounts, LinkedIn, Twitter, YouTube. Number 3, interact and repost our social media content. Number 4, send me feedback. I love getting questions, recommendations, story suggestions. It's just phenomenal to get your feedback. Really appreciate it. Bill at thisweekinhealthit.com. And subscribe to our newsletter on the website. So let's get to the news. Providence St. Joseph Health acquires Epic consulting firm Bluetree. This is pulled this story from hitconsultant.net by Fred Penick. Let's get to it. So Providence St. Joseph Health, a national not-for-profit Catholic health system, announced today that it will acquire Bluetree, an Epic consulting and strategy company that helps healthcare providers maximize the use of their technology. Based in Madison, Wisconsin, which I guess would tell you which technology they're focused in on, and with offices in Denver and New York, Bluetree's integrated team approach helps healthcare providers realize higher returns from their Epic EHR platform investment. Let's see. What are the benefits for Providence? By acquiring Bluetree, Providence St. Joseph Health will expand its current offerings to increase the value it delivers to other health systems across the country. There's number 1. The acquisition is part of a strategy to diversify revenue to support patient care in the mission of Providence St. Joseph Health. That's number 2. And with the addition of Bluetree, Providence St. Joseph Health now has 2 of the top EHR solution companies in the country. It will also Engage, it also owns Engage. Engage is the name of the company, which has grown to become one of the largest meditech solution companies in the United States. So what is Mike Butler, president of strategy and operations for Providence, said many health systems have invested heavily in Epic as the backbone to provide seamless patient care. The value add of EMR consulting is modernizing talent management, revenue cycle, and operations so providers can focus on their core strengths of delivery of care instead of pouring resources into technology investments. As one of Epic's largest customers already, Bluetree will enable us to build new revenue streams by expanding these services to other health systems. Let's see, is there anything else in this story? One last thing. So Providence St. Joseph Health announcement comes on the heels of other innovative ventures designed to diversify revenue to support its mission. In February 2019, Providence St. Joseph Health announced ION Health Solutions, a population health management company. Additionally, the health system acquired Lumedic, a next-generation revenue cycle management platform based on blockchain technology. Wow. So this is interesting because this was not a recommendation, but I got a bunch of questions from people on this acquisition. What does this mean? Is Providence still an opportunity for us? If you don't know, Providence has a date of like 2020 to migrate an additional 16 hospitals onto the Epic platform. So what's the so what for this? I think the answer to this is this makes perfect sense for Providence St. Joseph Health. They have the upcoming implementation, which I discussed, 16 hospitals going to Epic. I have a feeling the details of the financials on this were not announced, but I have a feeling it'll pay for itself in just those 16 hospitals being implemented. And so the transaction itself makes sense. I think they needed the in-house expertise. It's part of what their value proposition as they go into the community and they talk to other health providers to either partner with them on extending their continuum of care, or it's part of their strategy for acquisition and growth is being able to integrate those other health systems a lot quicker and with, I guess more defined programs around the EHR consolidation during those during those consolidation events. So, and I think the other thing that's obvious is it's going to grow the critical shared service revenue that they're looking for. So it's interesting because the conversations I've had have primarily been with solution providers, and they say, what does this mean? Well, I think it means you just gained a competitor. I mean, Bluetree was always a competitor, but now you've gained a competitor that's also a client. So you may have lost a potential client in the process of gaining a competitor. The other thing I would say about this is you can't underestimate the relationships that these hospitals have, networks across the country. When you look at it, the innovation groups from these various organizations across the country, they work closely together to either get these startups off the ground or to fund their second rounds, and you see them coming together more and more. I think this is another one of those situations where Providence is going to have a leg up on some of these EHR implementations because they have relationships. They're seeing these people, they're having the conversations. So I think you have gained a competitor. I think you've lost a potential client, those who are looking to get into that 16 hospital rollout. Now, with that being said, an Epic implementation across 16 hospitals is going to take hundreds of people, and I doubt that Bluetree is going to provide all of those. There's going to be specialty services. There's still going to be a lot of staffing associated with that. I imagine the big players are going to be around. Leidos and others are going to be looking at that revenue. So there's still an opportunity there. The good news, I guess if there is good news for a solution provider in this, is that other systems might look to follow suit and compete against Providence, which could create a market for these. I think that the players that make the most sense are the players that are focused in on EHR only, not 100 different services, but really focused in on EHR. They're sort of a niche player focusing on EMR implementations or even ERP implementations, and there could be a market for that now. You could see a large health system, a $10, $15 billion health system say, hey, that move makes sense to me. That will provide revenue so that we can do our internal. Think Amazon AWS. Amazon AWS essentially funds all of IT and then some beyond that for Amazon at this point. If you can grow your shared services revenue as a percentage of your overall revenue, that's going to fund a lot of technology initiatives. So interesting story. I thought I'd start with that one just because I got so many questions about it. Thought I'd just throw it out there. Our second story, and this is not as much of a fun story, but it's one that's very, very much talked about on social media and definitely talked about in the city of Philadelphia. So Philadelphia's Hahnemann University Hospital files for bankruptcy. This story I pulled from WPVI, ABC in Philadelphia, and the parent company filed for bankruptcy for both Hahnemann and St. Christopher's Hospital for Children, and now the city is trying to intervene. Changes are already happening at Hahnemann, with emergency department no longer accepting trauma patients as of this weekend, and that was before the 4th of July weekend. St. Christopher's is said to remain open, but there's still a lot of unanswered questions from both hospitals, although it seems like the intention is, well, I'll go on, I'll just read it. This morning, the parent company, Philadelphia Academic Health System, voluntarily filed for Chapter 11 bankruptcy, saying it will ensure an orderly wind down of operations of Hahnemann. While assuring patient safety, it will facilitate a restructuring of St. Christopher's, which will enable it to remain in full operation. Nurses at St. Christopher's say morale is low, and there's a lot of back and forth in terms of not really knowing what's going on and what's next. Meanwhile, Drexel University says the lawsuit filed against the hospital owners to block the closing to get back compensation for its partnership with Hahnemann to train physicians has now been referred to federal bankruptcy court in Wilmington, Delaware. So let's see, a couple more things on this. So they've not exactly been the best to work with. It's driven by personality of one person, and that personality can be erratic at times, said PAHS owner Joel Friedman. If this was a nonprofit company, we'd have the ability to force situations, but this is a private nonprofit. A private nonprofit, he continued. I'm worried that the health community and jobs of the employees and the doctors, that we're going to do our best to put our best foot forward, says Friedman. Let me give you some of the numbers here. So in the filing, PHS said it had liabilities between $100 and $500 million. Liabilities meaning deficits, debt, with only 10 to 50 million in assets. I don't think that can't possibly include the hospital and the land it's sitting on. The land it's sitting on easily covers that debt because it's downtown Philadelphia in an area that's being revitalized. But regardless, 100 to 500 million in debt, 10 to 50 million in assets. The company abruptly announced on Wednesday that it would shut down its 495-bed Center City, Philadelphia hospital and begin diverting patients from its level 1 trauma center. PAHS owes $20.1 million to Tenet Healthcare. Hahnemann and St. Christopher, former owners, owe $14.1 million to Drexel University, which operates Hahnemann's medical school, and nearly $700,000 to the city, among other debts. So there's some numbers. Oh, and the last number, Hahnemann handles 56,000 emergency visits each year, in addition to the thousands of other patients at its Center City location. So what and I'm going to do this from a health IT perspective in as much as I possibly can. I was treated at Hahnemann as a child. I grew up not too far from Philadelphia. I had to go down. I was one of those rural communities where you go to the city for some specialty care. So I was treated at Hahnemann. This is going to be hard for the staff. It's really hard for the people involved, hard for the staff, hard for the medical residents, hard for the local residents. I've been through this multiple times in my career, and it's just flat out hard. It does impact families. They're difficult conversations. And so I don't mean this to sound insensitive. I'm just from a health IT business perspective. But at the end of the day, there's 5 academic medical centers in Philly. They're not at a loss for healthcare. There was this map on the Philadelphia Inquirer which showed all the health systems and the geographies that they served. And this is surrounded by other really high-ranking, high-performing health systems. There's several EDs, and the closest of which is I think it said less than a mile. So the Jefferson Health ED is less than a mile from where Hahnemann is. The city technically is probably overserved in terms of healthcare, and the ED is less than a mile. And when I think about if say St. Joseph Health were to close in Orange County, the closest ED would be 10 miles, and that's a major city. That's when you think about that, 10 miles I think has an impact. 1 mile is not that much of an impact. Now I understand it's a community that doesn't have a lot of money, that there's a lot of homeless, a lot of Medicaid care and those kind of things, and they're saying that 1 mile can make the difference between them getting care and not getting care. I can't really speak to that. That is probably true, but I think there's an opportunity here, and I'm going to go into that in a minute. The reality is the business is broken. It doesn't make money. This surprises no one. It's a for-profit business, and they really can't be forced to stay open. So it is going to close. I think this will make the overall ecosystem in Philly, as a result, better. There's going to be pain in the process, but it's going to be better long term. And here's some of the things from a health IT perspective. Number one, health systems, health innovators, the ED continues to be overused. I mean, one of the biggest complaints about this is the ED, because quite frankly, if you're doing specialty care at this point, you're going to Penn, you're going to Jefferson, you're going to Temple, you're going somewhere else already. Really what this is about is the ED shutting down. And the reality is the ED is overused. And from a health IT perspective, we need new solutions to route people to the right level of care, period. However that's done, we should be thinking through that, which I think gets to my second point, which is we need to be thinking outside the 4 walls. That hospital is not necessary. It's just not needed. There are so many things, so many different form factors that can be put in there that would be much better. We need to be thinking outside the 4 walls, and how are we going to deliver care where it's needed? How are we going to get people to the place where they can get the appropriate level of care at the right time? And more times than not, it's not the ED. They had a story about a person with 104 degree fever, or not 104, 101 degree fever, who went to the ED who said, well, I don't know what I'm going to do now that the ED's not there. I'm like, CVS, Walgreens. There's a lot of places where we can deliver care to that person with a fever, for heaven's sake. So, and which gets to my last point, which is new venues of care. Banks are being reimagined as a cross between a Starbucks and an Apple store, even complete with a Genius Bar on financial services. So Hahnemann and others should be replaced with more appropriate, and you can read that, financially sustainable locations for health and care. Think a cross between, I don't know, like a health food store, like a GNC. Food would be better. So a food store and like a fitness store, complete with access to a Genius Bar with health services. And all those physicians and nurses and whatnot don't need to reside in that store. There could be ways to access those health services, but think a Genius Bar that you can go and ask those health questions that you want to ask. Or if you're sick, you could actually talk to somebody, and there is a way to direct people to the right level of care. As the poster on my wall says, my daughter painted me a great rendition of the old Apple ad campaign, "Think Different," and I have this thing right up here which says to me every day, "Think different," and I think we need to think different. That hospital doesn't need to be there. There's a lot of other venues that could be there, and that community would receive far better care. And that's not a knock on the people. The people are serving in an old model, in an old building that has been underfunded, and people can rethink how care gets delivered to that center city population. And I think this is going to be one of the easier transitions. If this were to happen, say, in Kentucky, in rural California, or even rural Pennsylvania, this would be a problem. It would be 40 minutes to your level 1 trauma care. But here we're talking blocks. So I'm not trying to sound insensitive. I'm just saying I think this care, any care gaps that get created will be closed very rapidly here. And on a side note, just expect more of these, more consolidations, more closures. And I would say, from a health IT perspective, be thinking this way. I'm amazed how few health systems have IT M&A strategies before the acquisition actually occurs. Get a plan in place. Okay, enough. Let's go to one final story here. So, and this is from the New England Journal of Medicine Catalyst by Charlene Wong and Namita Seth Moda. And this is why no single health incentive works. And they did a survey, responses to a survey of the New England Journal of Medicine Catalyst Insights Council members in January 2019 suggests that the financial incentives alone are not enough to move the needle to realize patients' health goals. The most effective approach to engaging patients to realize health goals is family, friends, support, which was chosen by 35% of the respondents, followed by education, 30%, clinician support, 30%, and financial rewards for healthy behaviors came in at 27%. So Charlene Wong goes on to say, she's the assistant professor of Duke University Department of Pediatrics, amongst 5 other titles. She says that financial incentives have a reputation for providing uneven results when it comes to modifying patient behavior. And I'm going to focus in on that modifying patient behavior statement because I want to come back to that. And number 2, the presence of real sustainability is limited. Patients change their behavior while financial reward is on, but when the financial reward goes away, their behavior tends to snap back. Along with a lack of sustainability, the impact of monetary rewards can become minimized if delivered in the form of biweekly paycheck, or if the reward takes the form of premium reduction that comes once a year at insurance plan time, because it's not in their face enough, I guess, is the reason that it's not really stated well there. In contrast, approaches rooted in social aspects, such as the support of friends and family, may have more lasting impact because people involved will, at least theoretically, have permanence in patients' lives. And I don't think anyone's going to disagree with that. Let me get to some of the verbatims, because the verbatims I think are interesting. So these are the some of the responses to what would work. And number one was explanation from this person, which is a clinician at a small nonprofit government health organization in the West. 1, explanation from providers. 2, level of understanding of patients. 3, level of commitment on patients to follow what he or she understands. And 4, we have enough tools to monitor improvement. Vice president of large nonprofit health system in the South says, an engaging, persuasive, passionate, caring doctor is the only thing that will work. Well, I'm not sure it's the only thing that will work, but it's a very bold statement. Director of large nonprofit teaching hospital in the Midwest, reduction in benefit costs for healthy behaviors like smoking cessation, colonoscopy, mammography, weight targets, etc. So, and actually in this study, it does note that some of those incentives do work better for those very specific items. So our clinic developed a food pharmacy which dispenses healthy food by prescription from physicians to our patients with diabetes. That's a CMO at a small nonprofit clinic in the West. And it also has the chart: family and friends support, education, clinician support, financial reward for healthy behaviors, making healthy choices easier through design, benefit design and incentives, financial penalties for unhealthy behavior, and peer pressure, et cetera, et cetera. So what on this? 1, it's the right question. How do we get better health behavior? It is a behavioral question. I get the results of the diet that I sustain. How do you change my behavior becomes the right question. Too many of our digital tools are lacking this analysis and efficacy on behavioral change. We measure the success based on, did they get Series A funding, B funding, C funding, have they attained unicorn status? And to a certain extent, I say, who gives a rip? Does the health system get the right press in the trade rags? Can we brag about our accomplishment at the next peer meeting? I'm not trying to point fingers at anybody. I'm just saying, essentially, are we measuring the right things? Are we getting better health as a result of it? Are we just looking at our success in this new math that we're looking at for healthcare systems? I really only care about how well a digital tool can help people like me and my family to really live a healthier life, to save us money, to simplify the navigation of health, to live with a chronic condition. I mean, those are the kind of things I care about. Give me a tool that does one of these things, and I think you've really done something. Finally, if you haven't thought through behavior change in populations you serve, and you're not, I just don't think you're going to be able to get me to be healthy. Just throwing education in front of a medical record is not going to get me to skip ice cream tonight after dinner. And quite frankly, that is what is going to have a lasting impact. That's what's going to be able to make a difference in my health and my diet. So think behavioral change in your digital tools. I love talking to digital health startups about their tools, their business models. There is such great promise there, and I'm glad they're getting Series A, B, C funding, and I'm glad health systems are investing in these things. This is really exciting stuff. But let's see if we can't cross digital tools and behavioral change and really make a dent in my poor eating habits. So there you have it. So that's all for this week. This Friday, I'd love for you to tune in. We have a really cool startup out of Philadelphia, and I have a great conversation with them. I look forward to sharing that with you. And I recorded that a couple weeks ago when I was in Philly. You can check out this past week, we talked about security. And a couple weeks ago, we had a conversation with Dr. Stephen Klasko and Nasser Nizami. Those are on the Friday shows. As always, on Tuesday, we cover the news. Hit any of those shows. Some of that stuff is still very fresh and exciting. Hopefully, you're enjoying this. Really appreciate you tuning into the show. Keep the comments coming to bill@thisweekinhealthit.com. Good, bad, or indifference. It really all helps. This show is a production of This Week in Health IT. For more great content, you can check out our website at thisweekinhealthit.com or the YouTube channel at thisweekinhealthit.com/video. Thanks for listening. That's all for now.